All right, good to go.
Okay. The Board of Athletic Trainers meeting is convening at 9:03 a.m. on November 1, 2023. The meeting is being held by MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. The Health Licensing Office asks that individuals attending through MS Teams keep your phone muted and cameras off during the entire meeting until you are given an opportunity to comment during the public and interested parties' feedback period if indicated on the agenda. Please do not use the chat feature during meetings. I will now call roll. Dale Isaac, aye. Haley Hay.
Aye.
Christian Stoll.
Aye.
Ken Takanaka.
Aye.
Jeff Kawaguchi.
Jared, did you hear him? Dale, did you hear Ken?
I did not hear Jeff. Did Jeff say he was?
Oh, you have to move over here then. You can sit on this side of me. Oh no, you're fine. Okay. He's getting his exercise in his laps.
Yeah, he's attending with us today, everybody. Nice.
Hello, guys.
Well, there he is.
Hi.
All right. Members, when you wish to speak, please state your last name for the record. Members are asked to not use the chat feature during meetings. Public members attending in person wishing to speak must first sign in on the roster sheet available. For public members on MS Teams, please email Carrie Edwards at carrieedwards@oha.oregon.gov and provide your first and last name. Public and interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. The meeting is now called to order.
Excellent. Thank you, Chair. First item on the agenda is approval of the agenda.
So we need other board members other than myself to make a motion to approve the agenda.
Motion to approve. This is Christian Stoll.
I second the motion. This is Ken Takanaka.
Okay, a motion has been made. I'll call the roll. Dale Isaac, aye. Haley Hay.
Aye.
Christian Stoll.
Aye.
Ken Takanaka.
Aye.
Jeff Kawaguchi.
Aye.
All right, got it. I vote yes. Okay, sorry. So yeah, motion has been made and it's been approved.
All right. Chair, next item on the agenda is introduction. The new member, Jeff Kawaguchi, but it sounds like everybody knows him.
Yeah, I know Ken and Dale.
Okay, so I'm gonna actually move out of the way so people can see you and go ahead and introduce yourself, Jeff.
Hi, I'm Jeff Kawaguchi. I'm the program director for the athletic training program at Pacific University in Hillsboro, Oregon.
Dale, if you want to introduce yourself, please.
Sure, Dale Isaac, and I am at George Fox University as a director of sports medicine.
Christian.
I'm Christian Stoll. I'm a family medicine physician at the University of Oregon Health Center.
Haley.
Hey there. I'm Haley. I am the reappointed public sitting member. I do not work in the realm of your area of expertise here. I work in the tech industry and just have an interest in sports and fitness.
And Ken.
Welcome, Jeff. I'm Ken Takanaka. I'm the clinical director at Orthopedic and Fracture Specialists in Portland.
And again, I'm Bob Bothwell. I'm the interim director here and have been for the last year and a half. And we have all the way over there, you may have talked to her, Carrie.
I am Carrie Edwards and I am currently filling in for April. You guys will be receiving emails from me if you saw those previously. I am also on the education side of the office. So my regular duties are like approving curriculums and helping with study reviews and licensing up front. So nice to see everybody.
And Ann.
Oh, hi, everybody. You've probably seen me before. I'm Ann Thompson. I'm one of 2 policy analysts here, and athletic training is one of my boards that I oversee. So if you have any questions, if you have communications from the community about issues or whatever, I would be the person that you would reach out to, and I would help you with that. So good to see everybody.
Awesome. Moving right along. Chair, items for board action. And we can handle that, or if you want to. It's up to you. Meeting
Yeah,
dates.
no, Bob, go ahead and go forward with that.
Okay. So the next item on the agenda, and this is Bob Bothwell for the record, are the approval of the 2024 meeting dates. We have for 2024, 9 AM on February 14 as your next meeting, and 9 AM November 6th for the other
Um,
meeting.
This is Dale Isaac. The one on the 14th, I think I'm going to be on an airplane that morning. So that one would be a conflict for me, it looks like.
Okay. Do you have a alternate date? Can we go the week out? A week out
Yeah,
from that?
yeah,
Or
the week
prior
out would be
to?
fine. The week out would be fine. Previous week or week
Okay.
after.
Give me a second. Let me pull up our office calendar. And we're going to look for February.
The next week, I believe is Thanksgiving.
Oh, no, this will be February of next year.
February 14, Valentine's Day. I didn't even catch that. Yeah, I'm on HLO. Something's not lining up. Carrie, can you look at your HLO calendar? See what it looks like, please?
If everybody else can make it, we'll still have one.
Correct.
It was originally for the 14th.
Yes.
14th to 2024. Is there anything on the 21st? I guess it would be.
Nope.
My first
So-
works for me.
Okay. I'm seeing.
Works for me.
Okay.
We're gonna change that to February 21st and November 6th.
And so did November 6th work for everybody? He's like, sure, my life's planned all the way up there.
A year from now, sure, sounds good. I can do it.
Sounds good. All right, so we're gonna change the proposed date to February 21st and November 6th.
Right.
Okay, got it.
So if I can get a board member to say so moved after I read, the board, approved, well, the board's looking for approval of the 2024 dates, 9 AM, February 21 and 9 AM, November 6th. So if a board member can say so approved.
So
Or
approved.
so moved. Thank
So
you,
moved.
Jeff. Ken, was that a second?
That was second.
Okay. Awesome.
I mean, roll call.
So yeah,
Roll call.
yes, sir.
Yep. So a motion has been made to approve the dates of the next meeting. I'll call the roll. Dale Isaac approved. Haley Hay,
Approved.
Christian Stoll,
Approved.
Ken Takanaka,
Approved.
Jeff Kawaguchi.
Approved.
All right. So the dates have been approved for 2024 meetings.
All right, moving right along. We need to take action for chair and vice chair. Let me get to a report here. So Dale, you are in a second term and your term will end April 20th, 2025. So if your comrades here want to reappoint you, you will be good for 2024. And vice chair is, who's the vice chair?
Christian.
Christian. Your first term ends March 31 of 2024, and so there, if you're going to reappoint, you would be still able to do vice chair, but we need other board members to chime in if somebody wants to nominate themselves or somebody else, or keep things status quo.
This is Dale Isaac, and I'll chime in that if anybody else would like to be board chair, I'm happy to pass that along.
I think we're pretty happy with you, Dale.
Motion to keep things the same.
Yeah, if everybody's happy with Christian staying vice chair, if we can get a motion for Dale as chair and Christian as vice chair.
I make a motion to reappoint Dale Isaac as board chair and Christian Stoll as vice chair.
I'll second.
Jeff.
Did I hear a second from Jeff?
Yes.
Okay, so a motion has been made to keep Dale Isaac as chair, Christian Stoll as vice chair. I will now call roll. Dale Isaac approved. Haley Hay,
Approved.
Christian Stoll,
Approved.
Ken Takanaka,
Approved.
Jeff Kawaguchi.
Approved.
Okay.
Awesome. The next item on the agenda appears to be director's report. Part of my what I need to tell everybody is, so I talked about Dale. He's in his second term and he's good through April 2025. Jeff is in his first term, and welcome Jeff again. His first term ends March 28, 2027. Ken is in his first term and it ends August 29, 2026. Christian Stoll's first term, and like I said previously, ends March 31, 2024. And Haley's in her first term and her first term ends October 17, 2023. Everybody, with the exception of Dale, can reappoint when your first terms are up.
And Bob, this is Derek Foltz. Just a correction. Yesterday afternoon, we did receive word that Haley was reappointed for a second term. So she's actually good through 2027.
Nice.
Congratulations.
Thanks, Haley. Thank you. All right. Thanks, Derek. All right.
Yeah, also didn't Derek have a continuing education report under director?
He does. So everybody met Carrie. So the HLO has had a temporary staffing change to our board specialist role, and you may be familiar with April Fleming as our point of contact for board meetings, coordination, and logistics. April will be out of the office for an undetermined amount of time, and our staff member, Carrie Edwards, has graciously stepped in to assist. Carrie may be contacting you to determine the quorum for meetings, provide you with the last version of board meeting materials, and notify you of board meeting changes or cancellations. And Carrie's contact information again is Carrie with a C .Edwards, common spelling, at oha.oregon.gov. And her phone number is 503-373-1902. All right. And Derek, why don't you go ahead and jump in with your other portion before I go to statistics.
Hi, everybody. This is Derek Foltz again. So just a little update. We've started doing a round of continuing education auditing for this board. First notices went out back in September, and we asked a total of 25 licensees to respond. That comes to about 6% of all active licensees for the board. So they had 30 days to respond, and the deadline was actually yesterday. We had about 2/3 of the individuals respond and were approved. And then the remaining third are going to be sent second notices going out today, and those will be sent out certified mail, and they will have an additional 30 days to respond to that. So after those 30 days, if they have not responded, then it typically will get sent over to the regulatory division and they will review it further.
This is Dale Isaac. I'm just curious. So when they are audited, what are they showing as proof that they've done the continuing education? Is it just that they're within good standing of the BOC to show they've done the continuing education? Plus, I think showing the concussion training that Oregon Health licensing requires of athletic trainers.
Yeah, so basically what we send them is an audit form, and it outlines the different options they can present to us as proof. We give them a time frame of their last renewal cycle window as when we want that proof to be obtained. And what I've received so far has been straight certificates of completion from BOC certified courses, listing their names, when it was approved, the course name, things like that. And it is going to be related to the athletic field industry. So that's what we're looking for.
This is Ken Takanaka. When I go to renew my license, the continuing education deadline is to make sure that you have enough CEUs by October 31st of the year, which I'm not sure why October 31st is the specific date, because the BOC deadlines are in December. So I'm just wondering if there's a reason why we can't get the two to align. Unless there's a specific reason for that from a licensure standpoint, I think it would make it easier for athletic trainers.
Yeah, so the way it works for us is that licensees have 1 year to renew, and that's the date from the license was issued. So that's going to be different for every person. So we ask that whenever that renewal window is for that person, that they provide proof for the previous year. So unfortunately, probably won't align with other deadlines, but like I said, it's going to be different for each licensee.
And Derek, did I hear you say, and this is Bob, it's for the previous year, it's not the current year?
Correct, yeah. So the window that we looked for was individuals who renewed through October 1st of 2022 through September 30th of 2023.
This is Jeff Kaguchi. I also have a question. The BOC accepts a lot of things beyond just approved courses. I get credit because I'm an item writer for the exam, for example. Our preceptors get what's called Category D for being a preceptor for our program. Are those acceptable as the continuing ed requirement, or does it have to be a BOC approved course?
Do you want me to jump in there?
Yeah, go for it.
Sorry, it's me. I'm sliding in. Hi, everybody. For the record, this is Ann Thompson. Our statutes are very clear as to what continuing education is for our professions. It has to relate to the profession specifically. And we do have some professions that get credit for their National Association from teaching or item writing, but the definition for CE for you guys is that you are in a receiving position of information related directly to your profession. So that's why sometimes our requirements are much smaller, because we understand that you also have, national requirements and stuff, but unfortunately it has to be that narrow per statute. Does that make sense? Okay, sorry, Bob. Just pushed him out of the way. Thanks, Derek.
Used to it.
So This is Dale. In light of the information that Ann gave us and the information that Jeff brought up, I'm curious, Derek, do you know how many CE hours are required per year for the Oregon licensees?
Yes, we asked for proof a total of 10 CEs or CEUs.
Per year?
Correct, yeah.
Okay, so that should be reasonable for our members that are receiving
Minimum of
CEUs
10.
through that are for the BOC that are not exactly educational type, I guess, CEUs, as Ann described them. Jeff, do you agree with that?
Yeah, I just want what was for clarification.
Great questions.
That's what we're here for. Clear it up if we can. Not to make something up. I'm joking.
I'm
Okay.
so sorry, Bob. I feel so bad every time I shove you out of the
That's
way.
okay. I'm married. I'm used to it. No.
Hey now. Dang. It's
Okay.
mean in here.
Moving on. Any more questions for Derek? Hearing none. Okay. So if anybody's following along on the slides, we're at slide 15. And it'll be licenses issued. So we do it by quarter and fiscal year. Fiscal year for the state runs July 1 to June 30 of the following year. So like right now, we're in quarter 2 of fiscal year 2024, even though we're in 2023 still. So in the first 2 quarters, we've issued a total of 23 licenses. Licenses renewed, the vast majority are online, but in quarter 1, we've renewed 128 on paper, online, 24 on paper. And those are 2 big numbers for me to give you a total, but I think it's like 152. And in quarter 2, we've renewed 14 licenses.
Boss,
Yes.
that number that's covered up is 99. I'll got it fixed now, but just so you know.
Oh, we're paper and online.
Yes.
Okay. All right. So, and back to that slide, which is slide 16. Thank you very much, everybody, for being mostly online renewals. It really helps us here. By age and gender, it's a relatively young profession. License volume trends, relatively static, all the way back to quarter 1 of 2022, we were at 127, and currently we're at I hope I didn't say 127, 427, and now at 434, and it fluctuates depending on how many are coming in and how many are leaving the profession, but it's relatively static, which is nice to see. And your fiscals, your beginning balance for 2024 was 455,000, and currently the ending cash balance is 463,691. And since we're early in the fiscal year, I would expect that would continue to grow.
Bob, this is
Yes, sir.
Jelly. Can you maybe for Jeff's benefit, kind of talk about the benefit of maintaining these cash balances where they're at?
Sure. So 400,000 probably seems like a whole lot of money. But for example, we've had cases in the past, and one of them was head trauma, and that investigation went on. I don't know, were you on the board then, Dale? Went on for a couple of years.
Yep.
And so we do not make legal determinations on our own, because none of us here are attorneys. And so we use the Oregon Department of Justice, and our AAG currently is Heather Fogelsong. She's been with us for quite a while. But any case, that is investigated, that's a serious case, or any case that may go to a hearing, could just run up into the tens of thousands of dollars real fast.
And
So,
can't get much of it back.
yeah, and we can, yeah, thanks. And so if we issue a notice to somebody for a violation, HLO can recover $5,000. If it were to go to a hearing, which could be really expensive, like I said, but we can cover up to $5,000 from a respondent, on top of whatever civil penalty or other the discipline that the board feels needs to happen. Make sense?
Yep.
Is that what you're looking for, Dale?
Yep, exactly. Thank
Okay.
you.
And does anybody else have any questions? No, moving on. All right, next on the list is the regulatory report, and I see Trampus is on there.
Hello, everybody. So we got your regulatory report here. It's got a couple of sections on it. We got the cases that have been opened and closed and their status, complaint types and complaints by type. As you can see, we only have one. We have two cases that are open for the 2023 biennium. Those are the only current cases we have open. We received 3 during that time frame. One of them is closed, and 2 of them are still open. And I can tell you that actually those 2 cases are the same respondent. So technically, we really have one case that is actually being currently investigated. So you aren't a super busy board with cases, but yeah. So this case, I would, it's probably going to get wrapped up here fairly quickly. But as you can see, there were the different type of complaints that came in. One was a licensing concern, and 2 were services provided. Most likely, it was the 2 here. 1 came in anonymous, and 2 came in other. Other would just mean the different types of complaints are anonymous, so we don't know who complained. The client, so that's pretty self-explanatory. If the actual client or the person receiving the services complained, it would be the client. And other is everybody else, which can include third parties, can include a parent of if a parent was actually the one to complain, it would be an other. If the person self-reported, it'd probably be listed under other. So pretty much other is a big category, but yeah. Does anybody have any questions about this report or investigations in general that I might be able to answer? Okay. I'll give it back to you all.
Thanks, Trampus.
Mm-hmm.
So we had a request about COVID data, and do you want to take this, Ann?
Sure, I can.
I will turn it over to Ann.
Okay, so if we could get in the Wayback Machine, the last meeting, Jeff was not here with us. There was a question, I believe it originated with Ken, who wanted to know about some of our licensing numbers and any potential changes in licensing numbers and or renewals during the period of COVID. And so what we did was we pulled the numbers from that period and are presenting them to you now, to you, Ken, and also everyone else for consumption. And what we found was there weren't that many changes. Some of our professions that we oversee, like cosmetology and tattooing during COVID, people couldn't work. And so a lot of them let their licenses go because they weren't making any money. And it didn't appear to be the case with athletic trainers. It looked like perhaps they were on salary, perhaps that, they continued to, it wasn't like they were laid off because of COVID. So was this kind of what you were looking to get at, Ken? Do you have any questions?
This is exactly what I was looking for. What I'm looking at is basically year over year, 2020 versus 2021, 2022 Q1 versus Q1 of the following year. And like you said, if anything, the license renewals went way up. I can't
Mhm.
recall back then whether there was a suspension of any kind of licensing requirements that would carry them through, that would explain the significant increase from Q3 2020 to Q3 2021. Because that's a big jump, which is a positive thing, honestly. So this is great. This is really, really good data. Thank you very much for doing this.
Of course, during that period, if it's useful to you, I did get lots and lots of questions from athletic trainers who have obviously plenty of medical training, asking if they could assist in the COVID efforts in different sectors. Could they do swabbing? Could they do vaccinations? Could they do all these things? And dozens and dozens of times a day, I would have to tell them not under your athletic license, because who you can work on and what you can do is defined in statute. However, if you were to work as a physician's assistant or be an EMT or get some other certification, perhaps the medical training that you have would let you help in that effort. So we had a lot of scope of practice questions, but not a lot of people needing. We did have several professions, again, that couldn't work at all, and they let their licenses go. And if you go what we call inactive, let your license lapse, it's not current, you start accumulating late fees. And we let you be inactive for 3 years, but to get active, you have to show that your continuing education's been kept up, and you have to pay a lot of late fees to get current. Well, it was within our power for some of our professions that were badly hurt, to let them get current for $1. So there were a lot of people that got current that way, but it didn't look like athletic trainers in any way were left to fallow during this period. If anything, it seemed like some of them came back and maybe entered the workforce in another capacity, but kept their license current. So I'm glad that's what you wanted, Ken. Is there any other questions from board members? No? Okay, well, I'll turn it back over to the boss.
From a public service or public safety standpoint, to my knowledge, and I certainly haven't looked at the scope of practice for every licensed healthcare professional out there, but the scope of practice for athletic trainers in the state seems to me to be probably the only one that limits who we can serve, which members of the public we can serve based on their choice of activity. That seems like, particularly during a time like COVID, that although we had the medical background and the ability and the training to treat these people, the scope of practice precluded us from doing so simply based on choices that they were making for recreation. Medical principles don't necessarily change based on whether you decide to participate as an athlete or not. And so that is one area that I think probably did hurt us a little bit in terms of our ability to serve the public during that time.
So, yeah, but a lot of the professions, like yours, require some sort of licensure or registration. And so, like as an EMT, you may be qualified for an EMT, but you probably couldn't provide those services without a EMT certificate. Make sense? So I totally hear what you're saying and completely agree, but we can talk mostly about athletic training, but we don't have the expertise with the other professions, nursing, EMTs, medical board type things, respiratory therapists, which were in need in during COVID, which we could talk about. And we were able to do something for them where they could come in and get a temporary registration if they were retired, for example, or they came in from another state, because one state may be flush with respiratory therapists, or Oregon was scrambling to get the assistance. But the other professions, it's really difficult for us to make too much of a comment on, because that is not our expertise, and we don't regulate them.
This is Dale Isaac, and I just wanted to, I guess, confirm with Ann that, and then regarding scope of practice, as the Board of Athletic Trainers, we do not set scope of practice, correct? And that has to happen at the legislative level.
Absolutely, absolutely. And this is something I've mentioned it to Jeff in his orientation this morning, Ken in his orientation. One of the, we talk about the statutes of the foundation of the House, and we only have the powers that are specifically given to us, right? Your board can only do what the law allows it to do. It's not like a regular person who can get up in the morning and decide to become a dog walker or whatever. You can't do that. A source of continual friction with this board and its licensees are the fact that you are medically trained with fractures and head trauma and all that. But the statutes actually define what an athlete is. It's under 688-701. Any individual participating in fitness training and conditioning, sports, and other competitions. Athletic injury means an injury or condition as it relates to participating as an athlete. And then it says practice of athletic training means the application of principles and methods of prevention of athletic injuries, recognition, evaluation, and immediate care of athletic injuries, rehabilitation and reconditioning of athletic injuries, healthcare administration, and education and counseling. And if you wanted to expand not only what you can do, but who you can do it on, and I mean, the thing that drives us up the wall as reasonable people is two kids. I mentioned this to Jeff. Two kids in high school fall off a bus and sprain their ankle. If one's an athlete, you can help one, but you can't help the other. And the reasonable person standard is that doesn't make any sense. But we are bound by what's in the statute. So if a member of the BOC or an association, I know you guys have a lobbyist, you have folks that are advocating for you. As a board, we can't do anything about it because we are the executive branch. We're here to carry this out and enforce these definitions. If there's an association that says, wait a minute, we have head trauma, we can stabilize displaced fractures, we can do all this stuff, and we can't swab noses during a medical emergency, they would have to go to the legislature, get a legislative person on board, and come up with a bill that alters this definition of what you can do and who you can do it on. It is a very, very common rub in this profession. And that would something that would change the foundation of the House, and it would widen who you can work on and what you can do. But that would take a change of 688-701, and that's beyond our scope. Does that make sense? Because we all have
Absolutely,
a scope of practice, and this is ours. So,
And this is Dale Isaac again, and
sure.
that doesn't preclude us as board members from being able to, I guess, lobby to change rules. We just can't do it wearing the hat of a board member.
This
Correct.
is why I love this board. You guys are so dialed in and you get it. As a person, as a practitioner, as a person who wants to further the profession, you can go and do it as part of an association or an individual. The important thing is when you are talking to the legislature, either as somebody pushing a bill or even testifying or providing support, when you sit down, establish what hat you are wearing. And that would be something as simple as I am writing to you or I am testifying. I am an athletic trainer. I'm a member of the profession. I'm a member of the board, but I am here as a parent, a professional, a licensee, a member of an association. So as long as you put it on the record orally, if you're testifying in writing, that yes, you're a member of the board, but this is the hat I'm wearing right now. You are more than welcome to do that. It's just very important that there's not the perception that you're there speaking for the board as a board member, because as a member of the executive branch, that would be inappropriate. Does that make sense? Right on. You guys are A+ students. I love it. Okay.
Yeah.
Any other questions?
Yeah, I have a question. This is Christian Stoll.
Sure, Mr. Stoll.
I fully support the Athletic Oregon OATS, Oregon Athletic Training Association, going forward. We'll try to develop more of a lobby. I do think that there are certain scenarios where athletic trainers are enabled to work to a higher level under a physician's direction too. And I don't want to miss that, especially for our public audience, where, you know, the physician may have certain direction to be like, okay, this is, you know, you've had the necessary training, in my opinion, and or there's an order to, you know, for an athletic trainer to do a certain activity that may lie outside their training, but they're basically working on their license of a physician in that situation.
That absolutely correct. And that's a scenario that affects kind of some of our other professions more, that say, excuse me, as an advanced esthetician who works on the skin, you may not be able to do Botox. But if you're a physician assistant working under a plastic surgeon, maybe you can do Botox. But it depends, what piece of paper, what authorization certification are you using to perform that? And if you have if you're working under a physician and you're essentially utilizing that physician's license, your scope may be very different from what you can do under your athletic training certification. Does that make sense? So yeah, you might be an EMT, you might also work under somebody else, and that scope will change based on, you know how we talk about what hat you're wearing? What certification you're operating under can change what you can do. But as an athletic trainer, if that's the only certification you have in your hand, you are a free roaming athletic trainer, and somebody says, can you inject Botox? No. But if you're working as a physician's assistant under a plastic surgeon, glove up. Okay, so it really just depends on what hat you're wearing, and that affects your scope. So that's absolutely correct. Does that help?
It does. I'll glove up.
Okay, great. So we'll get our Botox later on with Dr. Sowell. So, okay. Any more questions for me, or should I slide out of the way?
I just want to make a comment. This is Dale Isaac. Just to the other board members, if anybody ever has questions about what hat you're wearing, send Ann an email. She'll get back to you right away. She's done that for me in the past. And so she's just a really, really good resource when it comes to that piece of information.
Well, I'm just going to I always do this every board meeting. I never know what it's going to, I'm incredibly grateful that you very, very smart people are giving your time to protect the public and help us do our job as government people and provide us with so much information. I'm incredibly grateful. And so I am here to make your job as a board member as easy as possible. So if you have a question, concern, need a hug, just give me a call. Okay?
Thank you.
Above and beyond. Okay. Chair, public and interested parties feedback. Doesn't appear that we have anybody in the public that I can see. So we can forego that. And any other board business?
I will speak. Jeff mentioned before the board meeting started that he has had some comments from individuals that our website, I know you changed from a registration to a license a few years ago, and there might be some places in our website that have not kept pace. And that's something that I'll report on by the next, I'm going to look into that to make sure that all those registrations in areas that we can change have been changed to licenses.
Thank you.
Anybody else?
I have sort of a non-specific question or comment, I suppose, and it is around Senate Bill 1089, which is the creation of an advisor, a governance board for universal health care in the state of Oregon. So Senate Bill 1089, I believe, was just passed that approved the formation of that board, and they are tasked with creating a comprehensive plan for universal health care in the state of Oregon by 2027, and getting that to the governor. And so the reason I bring that up as sort of a non-specific topic is whether or not and how that might impact licensing of healthcare professionals in the state. I don't know if it does. I don't know if it will, but it's something that I wanted to kind of throw out there as to the members of this board to look into.
Familiar with that one, Bob?
Looks like it is a DCVS board program.
Oh. Yes,
But just looking at it real fast, that's all.
yeah, it
medical
looks like it,
assistant.
yeah, it's under just the Department of Consumer and Business Services. So that would be outside us. Well, that's fascinating, Ken. I'm gonna have to take a look at that.
It is, you know, they're obviously aware that this type of initiative has been tried in other states. And that's why, you know, they've got a fairly long runway in some respects, but that's a very short amount of time to figure something like this out and have such a comprehensive plan, both from, you know, implementation, you know, a budget, all those types of things. But this would theoretically increase access, but it substantially impacts healthcare providers, such as primary care physicians in our state, in a massive way. And so doing this the right way is important. And I just wanted to put that out there for the board, because it could have it could create a massive shift in terms of access to healthcare for people in the state.
Ken, if I could ask you a follow-up question, what were some of the things that got your attention? And when you say impact, what are some of your concerns with how this could overlay with the athletic training board and other professions?
I think it would impact athletic trainers in a very downstream way. What I mean by that is that right out of the bat, if you say that we're going to increase access to healthcare by doing a universal healthcare system in the state, you've got people who currently do not seek care potentially because of social determinants who will begin to seek care. That, coupled with the fact that we currently are already in a healthcare professional shortage in many different sectors, whether that's x-ray techs, primary care physicians, nurses, anesthesiologists, whoever that is. So then you start thinking, okay, you're increasing volume. In the same breath, you're saying that if you go to a universal healthcare system, how significantly does that impact how much money a physician or other healthcare provider can make? Because right now, because we have private payers, some of the payers pay better. And so from a revenue standpoint, how does that impact our hospital systems and our employed physicians and our physician-owned clinics, on and on and on? If their reimbursement goes down at all, we will see them leave. If we see any percentage of physicians, et cetera, leaving the state, and this is all, you know, this is all a guess, but what does that do to the access to healthcare for everyone? Do we have the right people in place? And even our scope of practice currently as a board of athletic trainers does not permit us to help in that scenario in a meaningful way. And so if we're fast forwarding to 2030, if this does go through, how do we keep an eye on what this does from a licensing standpoint to our athletic trainers? So that's what caught my eye. So I'm thinking like, 10 years down the line, but it's something real.
Thank you for bringing that to our attention, Ken.
No, it's a great opportunity for Oates to, consider having an athletic trainer apply for that board, who has some experience in, looks like healthcare delivery and finance. If there's someone who has that, they may be a really important person to also, represent the interests of athletic trainers, which I know has been a factor before. Well, that's legislation.
Yeah, this is Bob. It looks like it's at least a 9-member board. So it's a relatively good sized board.
Yeah.
So
Good to know. Thank you, Ken. Was there anything else for the good of the order that we need to add to the agenda next time? Or, I mean, obviously I'm going to report back on the website check. Is there anything else that we can do for you other than wish you well and have good holidays and see you in the spring?
all right. No hands and no shaking of the heads or anything. So Dale, if you're ready, you can read us out.
Okay. So at this point, the Board of Athletic Trainers meeting is adjourned at 9:53 a.m.
Thank you all
Thank
so
you, everybody.
much.
We'll see you in February.
Thank you.
Thanks, everyone.